sufficiently long.
Okay, perfect. All right, so we've got a good view. Okay. Probably want to close that door.
Yep.
Okay. Can we tell if anybody's watching right now?
Can you? I think Carrie come behind you.
Oh, there it is. Sorry, we're having trouble playing the video. Uh-oh.
Every second counts. Don't mess it up.
Yeah, it says here.
Oh, wait, there we go. I got it.
Okay.
Oh, yeah. 2 people are currently watching.
Nice. So I think we'll probably wait like another couple minutes and then maybe at like 4:05 we'll probably start. That's good. And so Nora, how are you going to know that it's your turn?
I know when you say that
Okay.
it's
All right.
that I'm the bad patient for the rest of it.
Yeah. Okay. So because I kind of want to close this door just in case we get a phone call. Or should
So
we
then
at least?
I wouldn't know.
You can listen in.
Just don't close all the way, just
Yeah.
crack it.
Yeah. You can listen in.
Okay.
Because if she opens it too, then.
That's true.
Okay.
I guess that's
I'll
fine.
just wait
I
outside
guess
the
that's
door.
fine.
No, just leave her
I
out
guess
there.
we'll just leave it open.
And if she gets a phone call, she just walks away
That's
and
fine. Yeah.
we don't have more.
Yeah.
And then Sarah jumps in as thoracic.
Yeah.
That would work.
No, you're gonna stay.
I know.
Yeah, the comments were pretty good.
I can
Your
also
husband
just
told him not to mess
let
up.
the, I was gonna say, I could let it go to voicemail, but then it'll ring a lot.
What did he say?
He asked if there were refreshments.
Oh. All right. So you're good. We're good on this end.
Can
How's my
everyone-
mic?
Yeah, I'm like, can everybody hear us?
Yeah. All right. So I think, is it 4-ish? 4:05. We'll start
Boring.
fashionably late.
Like normal.
Yeah. Okay. We got everything here. Right. What do you guys think?
Lauren says your hair is slightly messed up.
No, that's not good. Should I part it the other way?
My father said who's producing this thing? No organization.
Wait, who's the executive producer again? I think it was, yeah. Somebody wants to take responsibility?
All the good things are my responsibility.
So the
Everything that gets messed up
It's your fault.
is my fault. All right, sounds good. Why did I sign up again? Okay. All right, so why don't we get started? We'll probably get started. Let's take our spots. Is the light okay? That's good. All right. All right, hi everyone. I'm Dr. Sina with Novi Doctors of Physical Therapy. I'm very excited to be able to share some tips with you that I think will help keep your spine healthy, especially those of you that spend a lot of time in front of the computer. Why should you care? Well, instead of listing facts about how back pain is extremely prevalent in the United States and how it's one of the leading causes of disability around the world, I think you can look up those numbers for yourself. You'll be pretty surprised at those numbers. I want to start by having you imagine that you just got handed the keys to a car. And think about how you don't know anything about this car, how it works, except that you know how to drive it. All right? Now imagine that you need this car for every single thing that you do throughout the day. If something breaks down in this car, that would be catastrophic if it stopped working. And then also imagine that if it broke down, you wouldn't be able to get a new one. You're stuck with this thing forever. So obviously for the purposes of that analogy, we're really talking about your spine. And as much as I like to talk about cars, we're going to save that for another time. We're really talking about your spine. So by the end of this presentation, I want to accomplish 3 things. 1, we're going to get you familiar with some of the anatomy of the spine, some basic anatomy. 2, we're going to talk about some common problems that occur related to your spine, especially when you're sitting for prolonged periods of time. And then lastly, I want to talk about how physical therapists can help diagnose these problems and what some things are that we help or that we can help to treat these problems with. So I want to start first by some basic anatomy, by going over some basic anatomy. So the main thing, or the main parts that make up the spine, are bones that are stacked on top of each other. And keep in mind that in your neck there's 7, in your mid back there's 12, and in your low back there's 5, but we've simplified it here. And these bones are held together by a part that's called the disc. All right, now think about this as a glue that helps to absorb shock. And most importantly, it helps to limit how much movement there is between these two bones. All right? So one of the first common problems that we'll talk about is what we call hypermobility, which is when the disc allows a little more movement than it should between the two bones. As the disc breaks down, and it breaks down for many reasons, one of the reasons related to sitting is that when we sit in a poor posture or when our head's forward like this, it can put more stress on the discs and wear out the discs and accelerate this process of allowing too much movement. So we're actually going to show this to Dr. Schramm. She's actually got a disc that allows a little too much movement. So we're going to compare a disc that moves pretty well, and then we're going to compare a disc that allows a little too much movement. So how do we diagnose this in the clinic? So one of the first things that we do is we ask a patient to move whatever part's bothering them, and in this case it'll be the neck. And I just want you to look backward towards the ceiling a couple of times. Now, as we mentioned, there's 7 bones in the neck, right? So this movement should be divided evenly here. Instead, what we're seeing is that most of the movement is occurring pretty much in one part of her neck. All right, so now we suspect that one of these discs here is allowing more movement than it should. One of the ways that we confirm it, and this is how I'll have you pay attention and watch here, is we're going to first test one of the discs that's pretty healthy. And watch how much movement there is between these two bones. So that's not very much. That's pretty normal. And then we're going to go down, and we're going to compare the disc that's allowing more movement. And you can see quite a big difference here. So we go back to the top, and you can see the difference between this, pretty small, pretty normal, and then this one that moves easily and moves a little too much. So what are some of the things that we do in the clinic if we diagnose our patients with a disc that's hypermobile? Luckily for us, there's a lot of muscles in the neck, and one of the interventions that we have is we like to strengthen the muscles in the front of the neck. So we're going to show how we do that here. So we're going to show two different versions of this exercise. The first version is going to be a little bit easier, so you'll be able to do it.
Says you.
The second one's going to be a little bit tougher, and you'll see how here. All right, so we're going to start with the first. All right, so what I'm going to have you do is bring your chin down towards your chest, just like that, and then try to lift your head up off my hands. So she does a pretty good job there. That's not too bad. Good, and then relax. Now watch what happens when I move my hands to the disc that moves a little too much here. All right, so bring your chin down, and then let's see. Maybe not. So that's a lot tougher. She's not faking that. That's her actually having a tough time with it. Okay, and then relax it. Yeah. So that's one of the interventions that we have in the clinic to try to strengthen some of the muscles in the front of the neck to help support the disc. An exercise that I like to give patients at home that they can do in front of a computer desk is an exercise that uses a TheraBand. So what we'll do is we'll place this behind your head, and there we go. And then we'll instruct our patients to be in a nice posture, and then we'll add a little bit of resistance to the band. And what this will do is it'll contract these muscles in the back of the neck, while at the same time limiting how much movement happens between the two bones. So this is a great way and a safe way to strengthen your neck without placing excessive stress on the discs. So when I see a lot of patients, or a lot of people in general, when they try to strengthen their neck and they move their head, tied to a cable machine or other machines, and they're moving a lot, they're getting a great muscle workout, but at the same time, they're putting excessive stresses on the disc, which over time is actually probably more detrimental than having a beneficial effect. So how we like to train it is keep the disc stable, keep the spine stable, and then train the muscles on top of that. Perfect, thanks. All right, so now we've talked about one common problem, which is hypermobility. Good there. Another common problem that we'll talk about in the spine is related to excessive compression, all right? So if our discs have too much compression forces on them over time, they get weaker and they can bulge out. And when they bulge out, they can press on nerves, and that can be extremely painful, and it can cause a whole host of issues. There are many reasons that a disc becomes this way, but one of the reasons that relates to sitting is that when we sit, we're placing more compressive forces on our discs than when we do in standing. All right, so that's kind of counterintuitive for a lot of people, but when you're sitting, you're putting more compression on your low back than you are when you're standing. All right, and over time, especially if you spend a lot of time in that position, that can be detrimental to the health of the discs. So I want to show you guys how we diagnose this in the clinic. So let me lower this table down. So if we have a patient who we suspect that's got a disc in the low back that's sensitive to compression, one of the things we do is we'll have them lie on their side. All right, now oftentimes, if the pain isn't too bad to begin with, just taking pressure off of the disc will make the patient feel better. Now to confirm that we're dealing with a problem that's compression related, what I'll do is I'll add a little bit of compression, and this will usually bring back their symptoms. All right? Now in the case if I have a patient who I get to lie down and they still have their symptoms coming on, but I still suspect that it's a compression related problem, one of the things that we do is we'll decompress. And that typically feels better if it's a compression related problem. Right? So then I'll jump into the interventions here. We've got a lot of different ways to decompress the spine. We've got machines. One of the ways that we do it with our hands is just like that. And then we can also add a little bit of movement with it, or add a little bit of massage with it to help relax the muscles in the low back. And this pumping action can help with blood flow and with nutrient exchange to the discs as well, which helps with overall health of the discs. Perfect. Awesome. Thank you. Now, what do we have these patients?
Is it the internet?
Oh, it looks like you're good now.
Yeah, we're still on?
Hmm?
I think the number of people is so big that we're...
I think it's the Wi-Fi.
It's breaking the lines. Okay. So one of the things that we do for our patients who have a compression-related problem for their low backs, when they're sitting in front of a computer, a very simple thing to do is place a pillow between your low back and the back of the chair. And this will help take some compressive forces away from your back. All right? Another trick that we like to show people is, you want to show it? So we'll have them press down on the chair or on the armrest if the chair has armrests. And you can either hold this position or you can kind of go up and down with it. Yep, perfect. Now when people typically do this, they usually overcook it. So they'll push so hard that they'll lift their butt off the chair. Yep, just like that. And as soon as you do that, you're contracting all your abdominal muscles and you're compressing the spine again. So you're kind of defeating the purpose of the movement. So when you do it, it should be really nice and gentle. You don't need a lot of force at all. Your arms shouldn't get tired because you're not going to be pressing very hard. So that's a really nice way that you can do while you're in the computer chair, while you're sitting, without even getting up. Okay, nice. All right, so we've talked about hypermobility. We've talked about compression. The last thing we're going to talk about is kyphosis or excessive kyphosis, which basically means, fancy word for being bent forward. Now, as you can imagine, if we're in front of a computer a lot, we like to hang out in this position more than this position, right? And the more time we spend in this position, the more uneven the forces on the discs, it can make it tough for us to be flexible and be able to bend backward through our spines. So I'm actually going to show you two different cases here. We're going to show Dr. Schramm again. She's actually got pretty good mobility of the middle of her back. So we're going to show you how we diagnose this in the clinic. So let's have you cross your arms. All right. So she's got a little bit of a curve, which is normal. And we're going to have you try to bend backward here. And what we want to see and what we look for is a flattening of this curve. All right. Now remember that there's 12 bones here, 12 different discs. And so we can test each individual one, too, and see if one is particularly stiff, let's say. Okay, now I want to show you Nora, who doesn't move as well, and we'll see what that looks like. Okay, so cross your arms for me, okay? And then try to do the same thing. So bend backward. All right, so you can see here that Nora's getting basically no movement here. So she's cheating a little bit by using her low back to get herself upright. And that's one of the problems that this can cause, is that it can wear out some of the discs in the low back and cause pain down there. And then again, we can try to diagnose a specific segment as we test these out. Now, how do we treat this in the clinic if we diagnose this problem? Well, one of the ways that we treat it is we'll have our patients lie on their stomach, and we can do this in any position, but we'll choose stomach here. And we'll use a wedge. Make sure you tuck your chin down so that your neck's comfortable. Good. And we can stretch each individual segment here. And this is pain-free. We can spend a little bit of time on each level of the spine, or a level that we found that was a little bit stiffer than the rest. Perfect, okay. And then what do we tell patients who have this problem that we diagnosed, where they can't bend backward? What's one of the things that we can do at home in the office chair? Pretty simple. So, treatment table, office chair. Treatment table.
Oh.
Well, office chair.
Yeah.
All right, so one of the things that we do is you can use a pool noodle, or you can roll up a towel, and you want to place it in the back of the chair, cross your arms, and then what you'll want to do is sink back into it. Now, when you're doing this, if you're particularly stiff, we find that some of our patients, again, like to cheat down here, like she's doing. So make sure that you try to keep your low back against the chair, and then press backwards so that you stretch the middle part of your back, the part that's a little bit stiffer. And you can work this pool noodle or roll towel in different parts of your back, all right? And I'd recommend doing this every couple of hours, not for very long, 30 seconds to a minute. I think that's sufficient to help you keep your spine pretty mobile and healthy. Okay, so to kind of sum things up, we've gone over some basic anatomy. Remember that your spine is made up of bones that are held together by discs. As these discs wear out, we start to see problems where these bones move a little too much, where they get compressed, or where we start to have these postures that put even more stresses on the discs and cause further problems. And then we talked about how we as physical therapists can help diagnose some of these problems and what we do to help treat them, and some of the exercises that we show patients to try at home when they're sitting, so that they help mitigate some of the negative effects of all the problems that we've talked about. So I think we have a little bit of time for questions. If we have questions, we'll take some now. And then I'll practice this one more time.
I'm just getting yelled at on Facebook, that's all.
Why?
We had a couple people say hi.
Yeah, nice.
Say hello.
Hi, Mom.
Awesome, yeah. If we don't have any questions, we can,
There's also a delay.
okay. Yeah.
Like Dart just ran through.
Oh, really? Okay. Yeah, so hopefully it didn't cut out too bad. And, okay.
2 minutes for questions.
Yeah, we can give it a couple minutes, yeah.
Oh, we've got one. It says,
Is it a question we can read out loud?
diagnose, or do you need an MRI?
What's that?
Do you diagnose or do you need an MRI?
Yeah, that's a great question. So, a lot of these problems that we're talking about here are mechanical problems, and we have a lot of tests, clinical tests, like I just showed here, that give us a really good idea about what's going on with your spine without the need for MRI. An MRI is typically overprescribed, and for most back pain, we don't need an MRI at all. We can figure out what's going on in your spine without the MRI. Now, for my patients who do get MRIs, I tell them that more information is always better, but most often we do not need an MRI to figure out what's going on with you and to help you manage your pain. If we do need an MRI, we can order one, and we can recommend you to get further imaging, but like I said, most of the time we don't need one. That's a good question.
How can we help upper back flexibility if we have a lower backed office chair?
Yeah, so do they mean that the lower back chair doesn't come up high enough? Yep. You want to come sit back down? So let's assume that this chair maybe goes up to about here. Okay. All right. So if the chair goes up high enough to where the bottom of your ribs are, okay, that's probably the bottom of your mid back. What you can do is you can still stretch over it. So scoot back a little more. You can still stretch over it and use it as a fulcrum that way. If it's too low, so if it comes down where the pillow did, you won't be able to do it. In that case, what you can do is you can do the same movement lying on your back and using the pool noodle or the rolled towel and doing it on your back. So that's an option.
I've heard that placing your feet in a certain way helps relieve pressure on your back when you are sitting, like a wedge when your knees are bent a little more. Does that help while sitting?
So that's a complicated question because it depends on what you've got going on, right? So for example, for some of my patients who tolerate positions where they need to be bent forward more in their low back, so if they have stenosis, for example, what we'll recommend is that they actually sit a little more hunched forward in their low back, and we'll put a step on the bottom of their feet to get them to this hunched over position, all right? For my patients who can't tolerate that position, what we'll recommend is we'll put some support in their low back like we showed with the pillow to keep the spine in a more neutral position here. And then what we recommend with the legs is you typically don't want to sit out with your legs forward like that because that puts a lot of stress on your nerves. And we didn't really talk about nerves today, so I won't dwell on it too much, but keep in mind that if you feel a stretch in the back of your thigh or your calf when you're in a sitting position, that's not muscle that's stretching, okay? That's probably, especially if the stretch is going down your calf, that's probably a nerve that you're stretching and you don't want to do that. And the easiest way to make sure that you're not doing that is if you keep your knees bent so that your feet are under your knees, then you can ensure that your nerves are on slack and you don't run the risk of irritating them.
What kind of decompression machines do you have, and is that what's used for a bulging disc?
Yeah, that's a great question. So there's a lot of fancy decompression machines that are like thousands of dollars, and you don't need any of that, right? So we've got a machine here that we use some of the time. It works well. We have a lot of different ways that we show patients how to do decompression on their own at home. So if you have a bulging disc, and we determine that decompression is the right treatment for you, there's a lot of really low-cost strategies that patients can do at home and that we can do here without having the need for a fancy decompression table. I know there's a lot of tables on the market that some healthcare providers use in their own office and charge, in my opinion, an exorbitant amount of money for, which I think is totally unnecessary. But yeah, I think we can show you a lot of different ways to do traction at home by yourself with very little equipment.
So, question is, as someone with minor low back pain, you're saying the best way to quote unquote stretch my back would be to strengthen and reduce the pain.
So here's the problem with that question, and it's a question I get a lot. So minor low back pain is a symptom, right? It's not a condition. So you can have minor low back pain from stenosis, you can have minor low back pain from a disc herniation, you can have minor low back pain from a lot of different things. So until we get it diagnosed, until we know what the problem is, you can have pain from a multitude of things. And another common question I get is, I have back pain, what are some exercises I can do? Well, it's going to depend. Back pain's not a condition. Back pain's a symptom. So we have to we have to diagnose what you've got going on first so that we can tailor a specific treatment for you, right? So it's kind of like, I'm going to go back to the car analogy here. If your car doesn't drive straight, you don't just ask the mechanic, what do I do for it? They've got to figure out why it's not driving straight. It could be for a multitude of reasons. It could be a flat tire, it could be the steering rack's not right, ball joints on, whatever. So it could be a lot of different things. So until we figure out what the problem is caused by, it's tough to prescribe the right treatment for it.
That's the last question that we
Yeah,
have.
so that's a pretty common question.
Do we wanna wait another minute and see if someone, or do we wanna, oh wait,
With back pain, how should you sleep? Neck, middle, or low?
Yeah, yeah. So typically, again, same kind of question. Typically, what we recommend for patients is that you try to keep your spine in a neutral position, right? So our spine has natural curves in it, so our neck, it has a natural curve, and then our mid-back has a natural curve the opposite way, and then our low back, again, curves the same way that our neck does. So we want to try to position ourselves when we sleep in a position that maintains this neutral, these neutral curves for as long as possible while we sleep. So oftentimes what happens with patients who have, let's say, hypermobility, is when they sleep, they're not in a neutral alignment, and that puts extra stress on the disc. So let's say that I'm sleeping and I have a hypermobile disc in my C5, and I sleep like that all night, right? Well, now that disc is getting overly stretched out for 5, 6, 7, 8 hours. And then when I wake up in the morning, it's really, really painful. If I try to keep it neutral, then I ensure that not a lot of forces are going through it for a long period of time, and then I can maintain its health better that way. So typically I say try to keep your spine in a neutral position, and you'll know that it's in a neutral position because it'll feel more comfortable for you. If it's getting uncomfortable after 5 to 10 minutes, then you've got to change something. And the other thing that I'll say about that is that we always get asked, what's the perfect pillow, right? What's the best pillow to get out there? There is no perfect pillow without figuring out what pillow is the right size for you. So everybody's built a little bit different. We've all got different sized necks, shoulders, and then also it depends on what position you like to sleep. So a pillow that you use for sleeping on your side has to be different than a pillow that you use for sleeping on your back. It can't be the same thickness if you want to maintain this neutral position. So it's very individual specific. You know?
That's kind of a repeat. Any back muscle exercises to help with the spine?
Yeah. So I want to focus because we see a lot, right? We see a lot of people work out their back muscles or their neck muscles by moving through their spine. So doing like Russian twists for the abdominals, or using the back extension in the gym where they're moving a lot through their back. And these are great muscle workouts, so you'll definitely feel the burn in the muscles. But the thing to remember is that if you've got a hypermobile disc, it's going to put extra stress on those discs while you're working out. So even though you're working out the muscles, and it might even feel good during, and if you're young, if you're 15 to 25, you're not really going to feel any problems with it. It's not until later in life when you'll notice some of these changes that happen in the discs cause some pain. And so what we recommend for back exercises, just like all spine exercises, for most patients, is that you typically want to keep your spine in a neutral position and train the muscles from that position. Now, if we have athletes or like gymnasts, then we have to train out of those positions. But for the typical person who's spending 10 hours a day in front of the computer, you want to train those muscles in a neutral position so that you're not further loading the discs and causing more problems.
Will there be more interactive Facebook Live sessions?
So these are a lot of work. Yes, I love doing it, but they're a lot of work. They take a lot of
Yes,
practice.
Executive producer.
I want to thank, and they're not just me. They're mostly not me. It's mostly everybody else.
No, it was all me. It was all me. Thank you.
Yeah. So yeah, we definitely love doing these. Between like patient care and everything else, we'll try to find some time to put some stuff together. One of the interesting topics that or the interesting subjects that I am passionate about is spine care, because I think there's so much garbage, sorry to say, out there about how to take care of your spine, and people say different things about what are some of the best things to do, and all these gimmicky things that are sold on the market, that I really have a passion about trying to educate people about their spines, so that one, they know how to take care of them themselves, and two, if they need help, they know to go to the right person, so that they're not being sold snake oil, let's say.
Jenny says, great job, Sina.
Thanks, Jenny, we miss you. I think we're finally getting some warm weather down here from, or up here from Florida. Yeah, exactly.
We miss you, Jenny. I think that's about it.
Okay. All right. Well, thanks guys for tuning in. We'll try to do this again at some point. It was fun. And take it easy. Stay safe.